Good morning to one and all. In this video, let us say about dispose of old and expired medication. So suppose if you are not properly disposed the unused medication or expired medication, what are the consequences we are going to come across? In this video, even I am talking about various disposal practices which are observed among the people and what are the hazards we are going to come across because of improper disposal and which are the proper disposal methods. So according to WHO, it is estimated that more than 13 million deaths around the world happening every year due to some of the avoidable environmental causes. So there are many reasons for environmental pollution. Among that, even the drugs can also play an important role in contaminating air, water and the food. So thereby indirectly they can affect the health. Let us see like how to overcome these consequences. As we know, in every home, in the cabinet, it will be filled with dumped with some of the medications. Sometimes it may be expired medications, or sometimes the medication which was left over with a prescription, no more, it may not be used in future. So the medication, for different reasons, it will be stored in the home. In the home itself, if you observe, we have different community people here, like we have pediatric, we have adult population, we have geriatric people. A small community can be seen in a home. They store medication for different reasons. With the child, many times they come across with some of the acute infections or cough, cold. To overcome that, usually the parents, they have a habit of storing medication because these are seasonal and once the symptomatic. So when the symptoms get resolved, the drug will be get stored in the rack. Unused medications will be left over. Many times the parents, as a precautionary, they may store the medication, but the child, if it is not getting any acute symptoms, the drug may be get expired, unused. And with the adult, like usually they have some health issues, like it may be some of the chronic diseases like hypertension or stress mediated depression or anything. For that, the medications usually they store. And coming towards the geriatric people, so usually they have lot of polypharmacy because of many of the diseases which is commonly observed because of the aging. So they also store the medication. So many times drugs after purchasing also it may not be used in the home, it will be get stored. What may be the common reasons for storage of unused medication? Because coming towards the aged people, multiple comorbid conditions they will be having and polypharmacy can be observed. Polypharmacy is nothing but having a prescription of more than 5 drugs per day. So they may have multiple drugs, thereby sometime so they may forget to take the medications, or sometime because of the side effect which I have shown with the drugs, they may stop the drug administration. And many times what will happen, like alternative medication, the patient himself may get attracted or somebody have given him advice to take some alternate medications like Ayurveda or home remedies. With the help of that he may get recovered with the symptoms, or sometime he may quit taking the prescribed medication so that it will be get stored. Many times the patient may not be feeling compliance with the medications, so that himself he may quit the medication, but he may store the medication in a rack. And as the children may come across with some of the acute infections, in such conditions, after getting recovery, the remaining drug will be get stored. And adults have chronic complications because of that. Also the drug may be sometime purchased in excess and it may be get stored. And many times the patient have a tendency to change the physician for getting better experience. This is a common practice the people they are doing. They change the prescription. The old prescribed drug may be stored in the house. Not only the drugs, even many times the cosmetics which have been purchased in the market may show some of the allergic reactions, or many times the people get advice from their friends of better cosmetic preparation than the thing which is purchased by them, so that may also be get stored in the rack. So that home is a place where because of varied reason the drugs and other chemicals like cosmetics are get stored. Then other than like indirectly also many times the drug may get enter into the body. So say for example, veterinary products, many times antibiotics are given as a prophylactic dose for the poultry, so that if you are feeding that agent also, it may enter into the body. Or oxytocin, which is given in a dairy product, also may indirectly enter into the body along with the milk. So now let us see about some of the common disposal practices, along with the reason why the drugs are stored, which is unused, and what will happen to such drugs. So many people in the survey, they responded like they keep the medication. This is the habit they have, like until it get expired they are going to keep the medication, and once it got expired, many they told like they throw this expired medication with the household garbage. So if it is not expired, sometimes they have a tendency to give such drugs to their friends or relatives who are having the similar symptoms. So these are common practices which was observed with the community people. Then coming towards the expired medications, what are the things now commonly practiced in the people, like flushing of the unused or expired medications. So usually in the toilet they are going to flush it out, or sometimes wash basins they are going to flush the drug. Now what will happen in such condition, many of the drugs will get entered into the water sources. This is one of the dangerous issues which should be get addressed. Now all the drugs are not suitable for disposing in the sink or commodes. Like there is a selected list of drugs are there which are suitable for this, because many countries they don't have this drug take back policies, that they don't have any options other than flushing of the drugs in the toilet. So better to refer that FDA approved list for flushing. If you Google it, you will get that list. If you want to flush the drug, then the choice is this, like you should check whether the drug is suitable for flushing, so that we can go for that. But it's not a recommended practice, because the drug may get contaminated to the water supply. But in countries like India, there is no option, so that flushing method can be selected, provided we should make sure that quality of the drug depending on the approval list. And many survey it have shown like many people they have a habit of throwing the drug along with the household garbage, and many they prefer like toilet and sink, it's a major portion, and a major other is a garbage disposal. Only limited they have a tendency to return it to the pharmacy. Only selected pharmacy, depending on some terms and conditions, they may take it back, but overall unused medication or expired medication is not taken by the pharmacy. So now what are the dangerous effect of improper drug disposal? Already we have seen like two major practice the community have. One is the disposing in the sink, flushing in the toilet, or other like in the garbage. Especially in the garbage, if you throw the medications, so what are the dangerous effect persons may come across? One, like drug abusers may take the drug. If it have reached to the wrong person in a garbage, the people once they are separating the garbage things, like if it have entered into the wrong person, say for example you have thrown in syrup or a strip of medication which got expired, there may be chance of changing the expiry date, and once again it may be get relaunched into the market. Such events may happen, so that it should not reach to the wrong person. So that if you are discarding it, also make sure to strike out the labels or disturb the label. So then discard it in a proper way. In a coming slide, I will be talking like how properly we can dispose it. Or many times like poisoning can also may happen. So very popular practice even in India, what you can observe is the open burning of the household waste. Like many of the medications, they have hazards, like we should not go for open burning, because some of the inhalation like which is made up of aerosols, or even many of the deodorants also, they are aerosol preparations, so that they may catch fire, so that some fire hazards may happen in such condition. Even directly such substances in incinerator if you are using, because incinerators in properly if it is made according to the guidelines, so that they may be helpful for burning of the medications. but provided you should take care so that incinerator should not be used for incinerating the inhalers, so that it may cause some of the hazards over there. If incinerators are not properly made according to the guidelines, so that it may participate in the air pollution, it can disturb the greenhouse gases may get released, and even global warming can be observed. So now, what are the other possible effects which can be observed because of the drug improper disposal? As we know, like many of the drugs are thrown in the garbages so that it may enter into the soil, or many times animals also may feed some of the substances which got contaminated with the drug, or many times veterinary preparations also we have seen. So this is an incident which was observed in India because of veterinary use of diclofenac. So vultures, as we know, like they are the natural scavengers. They depend on the dead bodies. They eat the dead bodies so that they clear the environment. But the number of vultures got decreased. So one of the surveys have shown, like in 1980s, 80 million vultures were observed in India. But the recent studies decades back, like it have shown only thousands of vultures were left over. Then what was the reason for behind this? They made an analysis there. They came to know, like because of the kidney failure, the vultures are dying. Then they came to know like uric acid levels were more, and the reason they identified behind this was the diclofenac, which is an anti-inflammatory agent which was used in the animals. Because of this, the kidney failure have been observed with the animal. So that like improperly the drug, if it is used in the animals, so these issues can be observed, so that it may cause some environmental impact. Ecologically, they are going to disturb the environment. So then coming towards the other aspects, even pharmaceutical industries and improper disposal of the drugs also have been observed in some of the rivers which is very near to the pharmaceutical industries, where they have came across with some of the heavy metal solvents. Suppose if the people are consuming such waters, so then they also get contaminated. Usually such issues are observed whenever a massive death of the fishes are observed, then the community will come to know that the region got disturbed with the chemicals. Even some of the unimaginable route of drug can be seen in the environment, that is the excretory route. As we know, like all the drugs 100% it won't be get the metabolized in the body, so that some portion will be get excreted out. As such, like ibuprofen 10% may be get excreted in urine or fecal material, paracetamol 4%, and amoxicillin 60% drug may be get excreted. In various routes it may be get excreted. Topical, if you applied while washing the body, the drug may be get contaminated in the water, or in the sweat also it may be get contaminated to the water. And while disposing some of the transdermal patches also, because many of the drug percentage may be get retained, like 20 to 84% of the drug may be get remained in the transdermal patches. Later it may get entered into the soil. While disposing inhalers also, you should take care, like we should not incinerate it because fire hazards can be seen. Now flushing of the drug may get entered into the water supply, so that many of the aquatic systems may be get disturbed because of the presence of many of the drug. It was an incident which was observed in the Nehru River in Jammu and Kashmir, because the drug were observed there which was floating, which was used in the treatment of the COVID. And even international issues also, in Thames also they identified the traces of cocaine in river. Even chlorfibric acid was observed in US, and also chlorfibric acid was observed in the drinking water of Germany. So even the drinking water what we are using also may have some of the drug, because it's highly impossible to remove the drug. Even the purification process of water can remove many of the other impurities, but it cannot remove the drug which got entered. That's why you should safeguard. In the next video, I'll be talking about how to dispose the drug.